So when Ellen asked that question, I was trying to make coherent notes as to what I was supposed to say now, so it's Ellen's fault if it's not clear. So the first thing I would like to do is to make sure that Monique and Vicky are here, and if they're not, that somebody's gone to get them. I want to thank everybody for being here. I'm going to do this part in English. We have people who are from across Canada. We have injured workers. We have academics in different fields who are not necessarily interested in other aspects. And I think that the fact that everybody has stayed on and listened and shared and grasped, I think, the difficulties in working in a really transdisciplinary world across disciplines, across provinces, across spectra. I think the richness and the wealth of our team and everybody who is in this team and everybody who is partnered to this team, and I include the students in terms of people who are in this team, I think that this has been showcased, and I'm really proud of my team and proud of the people who are here, and thankful to the partners who have come and to the injured workers and other academics and people from workplaces, employers, and government who are here today as well. A few things, I'm not going to, I'm sure you are all relieved to know that I'm not going to review the last 2 days of content. I'm sure everybody is very attentive, first of all, and very tired of hearing speeches. So I'm just going to share a few take-home messages that I've had, either from the content itself or from the interactions with people off the record. One of the issues that has come up in our conversations is need for shared knowledge between provinces, between researchers and partners, about the ways in which systems can make workers sick, even if they're not sick, or at least not suffering from mental health problems before they get into the systems. And I think there's a lot of research that has been done in some jurisdictions about the iatrogenic impact of the process and how we tease out what's caused by the injury and what's caused by work, and that new interactions with our partners in other provinces might be useful to try to figure out what we can learn in Quebec from their practices and what Quebec can learn can provide in terms of practices that we've got. So new webinars on the horizon. We're not having another conference till 2023. I'm sure everybody is relieved for that. But we are going to have webinars, and we are going to have knowledge mobilization activities. And that's an example of the type of thing that I'm hoping we'll be able to mobilize. And how do we measure return to work? That's something that's come up in a few presentations as well. Often we say end of benefits is the unfortunately best measure of return to work because we don't actually have data on if they're actually working, and sharing among ourselves all the different ways we can measure return to work, because the people who come from an advocacy perspective know people who are not on benefits who are not working, and I think injured workers know very well that there are a lot of people who are not on benefits and not working. And I also know that there are quantitative studies that are not using as an outcome end of benefits. So I think in our agenda over the next few years, how can we measure return to work in a really inclusive way without losing the power of the data? I think that will be a challenge for us to discuss over the next few years. Several people, and several workers in particular, have reminded us of something that we already know, but it was always good to be reminded of the need to ensure our work is useful. And the fact that we have partners, I think, is the first step in ensuring that our work is useful. And the role of the partners is to keep us on our toes and to make sure that what they're getting in terms of feedback is something that they can rapidly transfer into something that will help them in their work. And that can be for the advocates, it can be for the employers, it can be for the unions, but to be able to mobilize the information or to make sure that what the studies are doing are actually going to be useful to somebody. That's what we're counting on the partners to do, and thus far they've been doing a wonderful job, and we're hoping that they're going to keep us on our toes for the next 4 years. I'm looking at all my partners here. But it needs to be useful for our partners, first of all, for unions, for workers' representatives, of the non-unionized and of the unionized, for other actors who are not in our team, like the healthcare providers. That was the previous grant. And you know, we were supposed to be very inclusive. I spent with Dana years, and Jonique and Lynn Holness, studying the role of healthcare providers in workers' comp. We have to bring that with us and make sure that we continue to share with healthcare providers outcomes like the outcomes that are going to come out of the mental health stream, for instance. And for injured workers, how to make this useful for injured workers in a way that they know that it's useful. Because I think there's two issues here. We can believe that what we're doing is useful for injured workers, but if the injured workers can't feel that it's useful, then we have a list of things to do to make sure that it becomes more visibly useful for the injured workers as well as the people who represent them. There's something that we can't deliver on, but that every day since I've been in Ottawa in 2006, I get email from injured workers, particularly English-speaking Ontario injured workers, and I can't help them. And I'm getting tired of this. So I think that if there are students in the room, and if there are professors in the room, and if there are future students in the room, I really think that on the common law side of work of the University of Ottawa, I'm in civil law and Quebec law, if we can try and find a pro bono clinic for injured workers, I think that would be particularly useful. It's not the job of this grant, but I think it's something that we will have to start thinking about because the need is there, and I hear it every time I organize a symposium. And my partners, and particularly the partners who are pan-Canadian or who are in Ontario, who can think of good ideas as to how to provide that. I'm not saying it's not necessary in Quebec. I think it's extremely useful. Et là, je vais changer en français pour 2 secondes. Je pense que l'idée d'avoir une clinique juridique pro bono pour aider les étudiants à apprendre à représenter les travailleurs et les travailleuses accidentés, c'est une bonne idée, qu'il faudrait le faire. Et c'est un besoin criant du côté ontarien. C'est un besoin aussi au Québec, mais malgré le fait qu'on n'a pas le Office of the Worker Advisor, il y a des organisations qui soutiennent, qui font en sorte que lorsque moi j'ai un courriel, je sais à qui envoyer le courriel. En Ontario, je ne sais plus à qui envoyer le courriel. Alors, mon cri de cœur pour avoir une représentation de soutien par les étudiants et par les professionnels qui peuvent former ces étudiants et en français et en anglais, et du côté du Canada et du côté du Québec. On espère dans les prochaines années qu'on peut promouvoir ça à l'Université d'Ottawa. C'est pas le rôle de cette subvention, mais c'est un besoin qui est manifeste. Vous avez été comme moi ici, les travailleurs accidentés. Ils ont raison, là, ils ont besoin de services, ils veulent comprendre comment ça fonctionne, comment on peut les aider. Et je vais rester en français pour surtout remercier, parce qu'on a passé une journée et demie très intensive. On a cet après-midi... you don't have your things on, so I don't know if you're understanding. But this afternoon we have a team meeting, so the team and the partners and the students who are part of the team are all staying on. If we're here and well-fed and well-organized and well-lodged, si on est ici en train d'écouter et concentré sur ce qu'on est en train de faire, c'est parce que le travail invisible de Monique Lefebvre, depuis qu'elle a été embauchée en octobre, qui est inlassable, le travail visible de Monique et de Vicky Sabourin qui nous ont aidés pour les 2 journées ici, ça a été absolument essentiel au succès de la journée. Alors, j'espère que vous allez les remercier. Et j'aurais voulu vous donner des fleurs, mais je ne pouvais pas demander à Monique d'aller chercher des fleurs pour que je puisse les donner à Monique. Alors, vraiment, ce sont des fleurs virtuelles et on vous remercie tout le monde. Alors, et finalement, notre gentil organisateur et facilitateur, animateur, Pierre Lefebvre, un travail invisible qui fait en sorte qu'on est à peu près à l'heure, il y a 5 minutes de retard. Avec les gens comme moi qui sont insubordonnés, c'est extraordinaire. Je suis content que tu le dises. Et enfin, une reconnaissance particulière pour les interprètes qui sont là et qui nous permettent de nous parler. Merci.